One of the biggest uses for iron in the body is in fact carrying oxygen in red blood cells in the blood. And one of the ways to counteract too much blood loss is a blood transfusion. But there are huge issues in terms of maintaining an adequate blood supply for the community. Tonic's Consumer Affairs reporter Karen Carey has been talking to Dr Simon Towler, who's been concerned about meeting these challenges of an adequate and safe blood supply and how consumers can be part of the solution. And as a declaration here, Karen Carey has sat as a consumer representative on a steering committee of the Australian National Blood Authority.
Blood is precious, and for someone who needs a transfusion, it can be the gift of life. But with increasing worldwide demand and low donor rates, we're struggling to ensure sufficient supply into the future. Some countries are responding to this challenge by paying for blood donations, whilst others are trying to reduce demand for blood products by ensuring that transfusions are only given when absolutely necessary.
What we've discovered is the rate at which transfusion, red cell transfusion, is used in the older population is some 6 times higher than the background average transfusion rate. It's the most rapidly growing sector of our population, and so we believe we face into the future a supply risk if we do not change our practice. It's not that we're trying to stop people using transfusion when it's necessary, but at the same time there are estimates worldwide that something like 30 to 50% of transfusions could be avoided by a more comprehensive, or what is now known as patient blood management approach, where you use alternative treatments. We know that you can largely predict transfusion requirement in the surgical setting. Preoperative anemia, intraoperative blood loss, and the practice of clinicians at what we call the hemoglobin trigger, in other words the level at which they initiate transfusion, predicts 97% of all transfusions in the surgical setting. If you address the needs of the patient in advance, then you can use other forms of treatment like iron infusions or oral iron.
The level of hemoglobin in your blood is used to decide when a transfusion is necessary, and the latest evidence is showing that this trigger point can be safely lowered in a hospital setting where they can monitor your symptoms closely. Overall demand can also be lowered by reducing the amount of blood that's given to each individual patient. An average transfusion uses 2 to 3 units, but the evidence is showing that less may actually be better.
When transfusion's needed, if the patient's not actively bleeding, the evidence suggests 1 unit at a time and reassess the patient. In fact, patient outcomes under these kind of programs are often better.
So wanting to minimise the use of blood transfusions isn't just about supply and demand, because there's risks involved, aren't there?
Absolutely. I mean, it's almost a transplant. This is allogeneic blood. It comes from another patient. Yes, we go through a cross-match process that ensures that there is compatibility between the donor blood and the recipient, but it's still somebody else's blood, and the body responds to that. And one of the great things you can say about receiving blood products in Australia, we have a high-quality service, and the risk of getting an infection from blood is surprisingly low. What has been forgotten are the other adverse effects. So what we know is the commonest things are still temperature or febrile reactions, which then lead to the transfusion being stopped, often relatively benign, but things like volume overload, in other words, too much volume in the patient, or a reaction called transfusion-related acute lung injury, which is an inflammatory condition in the lung, are now more commonly identified. But lurking in the background is still the problem of people getting a bacterial infection, particularly from platelet concentrates. What all this says is if you can avoid it, all the better.
So if someone's planning to have surgery, is there anything they can do to reduce the likelihood that they'll need a transfusion?
Anemia is increasingly common in our older population. If you manage anemia before surgery, you reduce the risk of the need to be transfused substantially. Here in Western Australia, a simple review of women presenting for gynecological surgery showed that 17% of people were actually anemic by the definitions on presentation, and their risk of needing a transfusion was 5 times higher than the patients who were not anemic. It's pretty simple. In most cases, simple oral supplementation for a month before surgery will improve your iron stores and reduce your risk of transfusion.
And what about using intravenous iron?
Intravenous iron is not something you would tend to do in general practice, but in fact I think there's a very good reason to consider that we might. If you give iron to patients who present with a hip fracture, then in fact their recovery is accelerated, their need for transfusion is reduced by 50%. In fact, there's even a suggestion that mortality is reduced. And I think that comes to part of the interesting story with iron. There's interesting new evidence that iron is both important for other functions in the body apart from making red cells, particularly in the area of muscle strength. And that, interestingly, with some recent work has been shown that iron deficiency in heart failure is in fact a problem for patients and should now be actively sought. And that's partly what's being defined through the new patient blood management guidelines.
Now you can help if you want in maintaining an adequate blood supply. Become a blood donor. And if you know you're heading for surgery, why not have a chat with your family doctor or surgeon about getting your iron stores up beforehand, because that will reduce the need for a blood transfusion.